Hey guys, Dr. Charlie Weir coming to you. As you see, the description is the explanation or the descriptions are, let me just say, starting to stumble around a little bit, answering the question we actually had. We had a great question from a member a couple of days ago asking me about retic counts versus hemoglobin counts and what they should be looking for. And actually, I'm answering only in this group here because, again, I told you guys that we want to give you guys special bits of information because we want to give you guys a lot of value to your life and, just to elongate things as well. Let me jump right into it. As we know, hemoglobin is basically the amount of blood or the quality of blood inside of your body. And then we're looking at how it flows around your body, things of that sort. So in general, in a healthy individual, we mean, someone without sickle cell trait, looking at a average range of 11 to 14. And then if you're looking at someone with sickle cell, it can range anywhere from, on a daily basis, 7.2 or 7 all the way up to about 11 or 12. So you see that wide range, and we all know the reason why we have those wide ranges of hemoglobin rates is mainly because of the fact that the reason why your body, you have sickle cells is because the protein that's making the oxygen hold into the blood longer is actually missing, so your body now is fighting, or you have that sickling shaping that's going on with your actual red blood cells, okay? So everyone already knows that part. Now, the retic count, a lot of people don't understand or don't, most physicians, we don't tend not to look at the retic count unless there's something going on. Retic count is usually coming into play when there's like something like leukemia or a tumor, or if there's an issue with your bone marrow, various amounts of things. But with a sickle cell patient, what we do is we'll look at it because in general, as an adult, you should have a 0.2 to maybe a 2% of retic count. What is a retic count? Retic count is basically immature red blood cells. It's basically the amount of immature red blood cells that's naturally inside of your body. When you have a severe infection, when something's going wrong in the body, and your body has dropped in the hemoglobin rate or your ratio, or hematocrit levels are not in range, the bone marrow itself wants to now start to produce red blood cells to actually help make up for that loss in hemoglobin rate. So if you have a higher amount of higher retic percentage inside your body, what happens is there's an indication that the bone marrow is now making red blood cells to make sure that you have enough hemoglobin inside your body. Now, as I just said, in a normal individual, that amount can be anywhere from 0.2 up to about 2 to 2.5% naturally in the body. And we see in sickle cell patients that can range as well. That can be anywhere from a 1 all the way up to about an 8, or even sometimes a little bit higher as a natural thing. Because if you are on different medications, because opioids can actually make your body lower the rate of how you're producing your red blood cells. So your bone marrow is now trying to produce more. So the opioids can actually increase the ratio of it. If you drink too much alcohol, that can increase it. Yes, and if you have different cancers or different infections, your body will start to produce, or the bone marrow will start to produce more. And your ratio, your retic count can be a lot higher. So long story short, people are asking me, what should you be looking for? In general, we already know from how you doing, Olga? I see Olga Mills just came on. I haven't seen her in a long time. How you doing? And in general, what happens is, as your body is trying to, keep your hemoglobin at a decent level, that's why with sickle cell patients, we try to make sure they're between an 8 and a 10, because this is a sidebar thing I'm going to tell you right now. Just because you have a higher hemoglobin does not mean that you're going to be out of a crisis or you won't have a crisis. In fact, I just read a study earlier today with the emergency department in hospitals. Over 100,000 different cases were actually looked at. This was back in 2015. And showed that individuals with higher hemoglobin rates actually had more pain when they went into the ER versus individuals that were actually had a lower hemoglobin rate. So again, that whole fallacy of saying that you have a higher hemoglobin rate and you're out of pain does not mean anything. This is when a lot of physicians have to be retrained and say, when someone says they're in pain, that they actually really are in pain, because part of the other study was to look at the hemoglobin rate and also look at the Retic rate. If the Retic rate was around a 5 or a 6, they were saying that, okay, well, the person's actually in pain, as well as the hemoglobin was below a 7.4. The person was definitely, they're trying to make some sort of algorithm to say that, yes, you're in pain or you're not in pain. But again, the best judge is always the person itself. So those are a sidebar type thing. So when someone asks me what should they be looking at in their blood work themselves, of course, you want you to have that high hemoglobin to get you closer to the normal, even though I just gave you that sidebar story. But again, the more oxygen you have in your body, because for me, having higher hemoglobin basically means you have higher oxygen levels and you have more nutrients in your system. And then when having a lower retic count basically means that your body isn't fighting itself either. That's what it means to me, looking at your blood work. Now, if you do have a naturally higher retic count, you have to go over a cross-section of your lab work. I say go back about a year or two, and not just look at it from a few months. Look at a year or two and see what your retic count generally really is. If you're around a 3 or a 4 and that's what you've always been, then that's who you are basically. Can you lower that by doing other nutritional things? Of course you can. But again, that's just a sign of the immature red blood cells that's in your body, and that means that your bone marrow is now working harder to keep your body going, and you don't want your bone marrow to keep producing red blood cells. You want your body to naturally produce them in a different way and actually get rid of all the broken ones as well. So that's just a little education. Hopefully I was able to explain that to you guys a little bit better. Of course, yes, look at the hemoglobin, but look at the retic count just as a sidebar type thing, making sure that your body isn't working too hard to keep you healthy, and that's an overall thing as well. So again, if you guys have any questions, always feel free to give me some comments down below. Give me some thumbs up, give me some hearts or whatever if you guys understand. If you don't understand, please let me know. I'll try to come back on and explain it to you a little bit different again, because I know interpreting blood work can be very tricky. Especially in this community here, the first thing we always look at is like, what's your hemoglobin is doing right now. We look at that, and then we as physicians look at other things to make sure that your overall body is working and is not overworking itself, to make sure that you're overall healthy. Because we do look at your creatine, which means that how your kidneys functioning. We look at what we call organic acids, which basically means that, how's the spleen function, how's the pancreas function, how's the actual gallbladder, if you do have a gallbladder, it's actually functioning as well, and also different liver enzymes too. So we look at all those things to make sure there's not too much stress on the body. And the overall thing is to make sure that we're lowering the amount of stress your body's having on itself, so you can have great red blood cells and great oxygen production inside the body as well. So again, if you guys have any questions, please feel free to continue to ask me those questions so I can clear it up a little bit more for you. Like I said, the retic count is just really a matter of the immature red blood cells. The other thing I wanted to discuss, and this is not sickle cell related, but I gave you guys on another Facebook Live a few days ago, I was telling you guys about the chocolate from my friend, Dr. Alan Spring. And this is something that, it can be sickle cell related, but it was more so diabetic, just nutritional wise as well. You see something sticking out my pocket. It was helping me to actually get this. I know it's backwards, but the name of the company is called Dr. No. And if you see it, I'm sorry, the camera's messing up. Dr. No, this is, like I said, it's his company. And essentially, the way he's produced this, and if anyone's aware of what the keto diet is, or ketosis or whatever, is a nutrient that's going around. It's basically where essentially you're eating a lot of fat and you're also fasting at the same time. So basically you're allowing that fat to really do its job, is to really burn itself out of the system. And I had quite a few patients that's on a diet right now. I'm not on it. I'm just vegan, and I just starve myself anyway because I only eat twice a day. It's a sidebar joke. But the reason why I brought this up about this chocolate was Dr. Spring has written 14 different books on health and nutrition. He's an MD, but he only uses natural medicine. He doesn't use any pharmaceuticals at all. I think the only pharmaceutical he may use is like Flagyl if someone has like a real bad stomach intestinal thing going on. But other than that, he doesn't use anything at all. He actually coaches a few Olympic divers. That's how I actually met him. I'm doing some injury rehabilitation with some of his athletes. But anyway, what he did with this chocolate right here, he formulated it in a way that it has no sugar in it at all. It has a sweetener with stevia and another type of natural thing, a natural sweetener in here, but it's completely all natural. It does not even spike your blood sugar. Dr. Spring has done many different research studies with this method of producing chocolate, and he actually showed that he had a group of diabetics. I'm laughing because I thought like anyone will volunteer for that was crazy, but he had a group of diabetics eat 3 bars of this at once. Eat 3 bars of this size chocolate right here, and measure their blood sugar in different hour increments, and their blood sugar did not move. In fact, their blood sugar actually dropped down. This is no lie. And in fact, actually, the thing that we were discussing a while ago was what tends to happen is the next morning after the person has went to bed and woken up, their blood sugar is actually lower, meaning in a good range, when they actually wake up. And after a period of time, the A1C starts to respond and everything else because of the fact that the cacao and cocoa inside here is actually natural antioxidants. So it's actually repairing some of the damage that's done inside the body, coupled with the fact that it has a lot of the good fats in here too. I'm gonna post this on the other public site, but I wanted to show you guys what this is. Lifeextensions.com, actually you can buy it from them. And like I was saying before, we may actually start selling this on the Healing Blend site, only because of the fact that I really believe in this, because I have a lot of individuals who are on different diets that I put them on. And my diets, I call them, most of them are sugar control diets, or not having a lot of sweeteners except for dried fruit, or just fruit itself. That's the only sweeteners or anything sweet you can have in there. So now I'm actually giving my patients a lot of this chocolate, and everyone's loving it, and people are actually getting healthy with this too. It's kind of weird for me to be promoting chocolate. But when I tell you this thing it was kind of funny to me that he even came across it, or he even started to produce it. He's kind of a weirdo. He has a blueberry farm up in North Carolina that he produces his own blueberry different remedies too. So, but again, you can check him out. I think the website is Dr. No, because again, that's how he sort of built himself as well. So it's an all-natural product that is definitely on the market. Sorry, the camera's turning around, so hopefully you guys can actually see it. So it's one of those sidebar things that I'm trying to give you guys as much information, add value to you guys' lives when it comes to diet, exercise, nutrition, as well as hydration. And then the main thing for me is also stress relief. What are you guys doing on a daily basis to relieve that stress? Because as we know, over and over again, I've said this, stress is the most idiopathic disease out there, and it is now listed as a disease. Over the last 15, 20 years, they listed it as a disease now, because we nowhere knows how it's going to affect your body. The one thing we do know is that when you're in a high stress situation, I've given the stats before, you're 54% more likely to have type 2 diabetes when you're in a high stress situation, or you're under a lot of emotional stress. There's a lot of other things that go along with it. We know patients with sickle cell disease, the minute that they're in a high stress situation, they can go into a crisis, their body breaks down. And that's really because of the amount of cortisol that's in their system, that stress hormone that attaches and it causes so much inflammation constantly in their body. And the fact that the body pumps the blood around the heart pumps the blood around the body a lot faster. And if you're not producing the red blood cells fast enough, the body's going to start to shut itself down. That's when those retic rates, I bring that back in here, starts to go up, because now the bone marrow starts to produce the red blood cells too fast, and the body just can't keep up. And that stress loops just continue over and over again. So the thing I've been practicing over the last, I say, 20 plus years is how to keep my body relaxed, and also teach others how to stay nice and relaxed, to make sure that, one, the type 2 diabetes risk is definitely down. 2, the inflammation inside the body is down, as well as, I say it all the time, we're the most constipated civilization or country in this world, because I say 95% of my patients, when I ask them how often do they actually go to the bathroom, they say every other day or every 3 days they go to the bathroom, which is like kind of crazy to me that people don't go to the bathroom every day. Again, I'm sort of all over the place right now, but it all comes back to, stress and how the body is going to produce the hemoglobin properly inside the body, and make sure that the extra stress that is going to be put on the bone marrow is not going to be prolific as well. So I know, like I said, I'm all over the place with everything, but my theme really is the amount of stress that's in your body to make sure that the body is going to keep working very well. Once again, if you have any questions, always feel free to ask me the questions. Give me thumbs up, leave comments, say something. But I think I'm done for tonight. I'll try to get with you guys in a couple of days to answer a few more questions that I had, but I really wanted to get that question out about the hemoglobin and retic situation, and hope you guys stay healthy. Good night. God bless.